Hello and welcome to Yodo. I wanted to give you an eye update on how I'm doing after my cataract surgery. It was just like any other procedure. I had to fast. I started some drops the day before. I went in early in the morning and waited, and then they put me in a room, and then I waited some more, and then of course they take some of your clothes away from you. But they dilated the eye progressively, and I guess that they really make that pupil large so that they can take your old bad lens out of that eye. They gave me some medications, and I can't say that it really made me all that drowsy, but I think maybe I was goofy later on in the afternoon. I think the guy did a great job. He said later, you did a good job. I don't think he did, because he kept telling me to hold my eyeball still. But there's like a little red dot that you're supposed to focus on, and it looked like to me it kept moving, so I'm following it around with my eye. It's like, hold your eye still, hold your eye still. But it went really well. It was completed without incident, and I had a driver that picked me up, because they won't let you drive, and they have to make sure that you got a driver, so they're really careful about that. And then they kind of put like a shield over your eye to protect your eye for the rest of the day. And then they had me come back into the office in the afternoon, and they checked the pressure in the eye, and my pressure was really good. So I'm fortunate that I don't have an elevated eye pressure, so I didn't have to use any kind of extra drops, but they did have me use an antibiotic drop, and I am still using that antibiotic drop. I wore the eye patch like a shield to work the next day, and just because I'm kind of goofy and my kids are also kind of goofy, I had that eye shield on, and then my kids had got me some googly eyes, and I put a googly eye on it, and then they put an eyelash on the googly eye. So I did look kind of silly for the next day, and it was a great conversation icebreaker with some of my patients. Having serious conversations with people, it's sometimes nice to have a little bit of something funny to kind of laugh about. And so having that googly eye on there the next day, and I think I wore it for 2 days, I wore that googly eye. And then I got me some like clear, almost clear, minimally tinted sunglasses that kind of wrap around. I don't have them here, or I would show you, but I want to protect that eye. I've talked to some health professionals, a nurse practitioner, a physician, and a nurse that all have had their cataract surgery done and work in the hospital, and each one of them had problems with eye infections. And so I think some of that may be just germs in the air. Some of it maybe we inadvertently touch our eye with a dirty finger. So I'm trying to protect my eye from what might be in the air, as well as from my own dirty hands. And we do the best we can to wash our hands, but inadvertently you might touch anything, and I just don't want to introduce an infection into my eye if at all possible. So I'm just trying to be as careful as I possibly can. I'm really pleased with the eye and with the results that I'm getting with the vision already. They popped the lens out of the glasses on that side, and I wore the glasses, but it was sort of like the depth perception was so off. I felt like I could see with the good eye, and I could see with the natural lens eye with the glasses on, but they were so different. It was really difficult. And so I had somebody drive me to work and pick me up after work for several days. And then I found some contacts that I used to wear, and I can't say it's the same ones. They're those dailies that you throw away, and they haven't outdated. I don't wear contacts very often, but I have sometimes been wearing that contact in the right eye, and it does still have a little bit of that depth perception problem, but I feel better. So I can at least feel like I can function at work and not be like not being able to see in one eye and being able to see great, really great with the new lens. I still have to, have the nuisance of having somebody take me and pick me up, because driving with one eye, I have a newfound respect for anyone that has limited vision and only has one eye. My goodness, that's just something that you really must have to get used to. I've had no pain, maybe a little bit of aching. I slept in a recliner, so I'd keep my head straight. I didn't lay on my side. I was really careful. I didn't bend over. I've had a lot of people tell me, the different precautions that their doctor gave me. My doctor didn't give me a whole lot of precautions. I kind of like a little towelette that I clean the eye with morning and night, and then I put moisturizing drops in it, and then I put the antibiotic drops in it, and the vision seems like it's continuing to improve. And I don't want to say it's clearing, because it was never like it was cloudy, but it was like my brain did not quite know how to interpret the information that it was getting through this new lens. And yes, there's some halos around lights, but I can't say, looking from my bad eye to the new lens, that it's significantly different. Because of the cataracts, I have halos around lights anyway. But my goodness, the sharp vision, the difference from the left eye to the right eye, with whites looking whiter, and whites used to be kind of beige or ecru, and so things that were beige or ecru almost looked yellowish or brownish, and it's much different left eye to right eye. Well, what's really impressed me is when I first got home, I was really having to hold something out to really be able to read it, and now I can read to hear. It is amazing. I haven't been able to read here. With progressive myopia, like this is my other eye, my natural lens eye, and I got to hold it, right up to my face to see it. So I can see down the road, and I can see close, and it's just fantastic. I'm glad that I'm doing the weaker eye, and I guess I shouldn't say weaker eye. I should say my non-dominant eye. My left eye is non-dominant. I'm very right eye dominant, and I think I'm training my brain how to use that lens. And I think if I did the right eye first, I just don't know that my brain would adapt as well, because I'm forcing my brain to use this left eye. And I think that's really, really helpful. Yes, I still have the floaters. I can't say that they are more clear. They were the first couple of days, but I think your brain learns to ignore those floaters. And so I think with each passing day and learning how to use this lens, I think I'm becoming less aware of those floaters. I don't think they're going away. I just don't think I'm as aware of them. And the advantage of being able to see shapes, see colors, see letters, see down the road, and be able to read is really fantastic. So I've had a great experience with getting cataract replacement done, and I'm glad things are going so well. I'm really looking forward to Stitch Day 626, because that's when I get my next eye done. Thank you for the kind comments. I really appreciate you guys being so supportive. And I've had you guys reach out to me through the channel, and reach out to me on LinkedIn, and I'm just really grateful. We've got a really nice community, and I'm thankful for all of you guys. Thanks for subscribing. Bye.